if any of you, that's a nice angle. Do you practice these angles, you know?
I do not, as a matter of fact.
So far, we've learned that Dr. Dobbs has a sky roof in his car.
It's my wife's car.
I understand there are people who rate rooms I think the people we're waiting on are Walgreens and CVS, and we need them here.
I'm on. It's Angela Hoover with Walgreens.
Hey, Angela.
Hi, nice to see you. Oh, you can't see me though. There you go. What was that?
You're not in an automobile.
I'm not. I'm in my office where I have a 6-year-old around the corner and a dog that usually sits right behind me. So I apologize in advance.
Dr. Dobbs is in a vehicle with a sunroof. I was impressed.
I saw that.
There's something up here that says Grant Fox, but there's no picture. Oh, now there's a picture of Grant Fox.
Yes, sure.
Plus, remind us, but it happened.
No one wants to see the people from Chickasaw County.
Okay.
Senator Bryan, we also have Roy Armstrong on from Walgreens for to assist with me. Thank you.
And I think we're waiting on Brooke Tyner with CVS or whoever's going to be here from CVS, and then we'll be ready to go. I have no idea who's, oh, somebody did, I heard a ding. Who just dinged?
I think that was probably me, Senator Brooke Tyner with CVS Health.
Brooke, thank you. I think we have everyone here. I assume everyone can hear everyone. I don't know how this works. Can everyone hear everyone else talk?
Yes. Yes.
So
Yes.
what I have to do is just start talking and go from there.
Yes.
I can hush and let other people talk. I know I can do the part about talking. I'll try real hard to do the part about hush and let other people talk. This is, and thank you all for doing this. I'm not very technologically savvy, and all of this stuff just drives me nuts, but no one can notice the difference. So anyway, I was trying to figure out how to give information to people in the community who are like 75 and older when it got time for them to be immunized. And on the way toward doing that, I encountered the situation with nursing homes. And I'm just interested primarily in this meeting in talking about nursing homes and when the immunizations are going to take place and what might be done to bring that about more quickly. It's my understanding, and somebody correct me if I'm wrong, that CVS and Walgreens, and I want to apologize to Walgreens right now. I want to apologize to Angela, to Roy Armstrong. I'm going to call you Walmart. I know better. I do that sort of thing. I know I'm not the only one. I apologize profusely, but anyway. But Walgreens and CVS are in charge of immunizing nursing home patients and nursing home staff. I've got some information about when the schedules are, and there's some nursing homes which either have no scheduled date, which have a date of like January the 27th, and there's one that even has a date in the early part of February. And it sure does seem to me there ought to be some way to get to every nursing home in the state by the end of next week. I'm assuming there's some obstacles that I don't know about. And so what I would ask by way of starters is what can happen so that from the perspective of CVS and Walgreens, that this can get done more quickly? What does CVS need? What does Walgreens need that would let this take place more quickly? At this point, I'll hush. Brooke, do you want to go first?
Well, I can tell you, then thank you, Mr. Chairman, for having us. Appreciate it, and appreciate the opportunity to talk about this. I guess I will tell you that I'm not aware, and I apologize because I don't have our schedule in front of us. As I told you, I think earlier, I'm not aware of facilities that are scheduled out, at least the skilled nursing facilities that are scheduled out that far. However, I'm certainly willing to talk about that sort of individually. But what I can tell you about the schedule generally is that we committed under the program, under the federal program, and to the CDC to have the populations that were activated completed, the first clinics completed within a 3-week time frame. And when we began under the program, staffing for that and working to staff for that, that was the goal. That's what we committed to. That's what we committed to when we signed up for the program. And that's not just in your state. That's in every state. Now, can that and could that happen more quickly? I think the answer to that is perhaps, but it is on that time frame that we're working on all of the populations, not just the skilled nursing facilities. So I don't know, Angela, if you have anything to add to that, but we are talking one-off, and I've had some discussions with Susan and others about allowing out-of-state licensed pharmacists to come into the state to complete this program. Now that we have both the SNFs and the other long-term care facilities, we do believe that will help with the process, as it has in some other states. But we can't say, at least right now, how that would affect the time frame, because obviously we don't have that capability to bring in out-of-state pharmacists right now. And we appreciate the help. We appreciate the help that Susan's provided, the information she's provided, the work that she's doing. But we can't say specifically how that might affect the outcome of the schedule right now. I don't know, Angela, if you have anything else to add to that.
Sorry, I had to figure out how to get myself off mute. No, I would say similarly. I know that we have had conversations with the state, with the Mississippi Department of Health, asking the same thing. If there is a possibility to allow out-of-state pharmacists, that would assist us. We're looking at all possible ways to, add providers to help us get through the list. I will say that out of the for our first doses, we have 75% of our skilled nursing facilities scheduled. So we're working through that first dose. But yes, as far as providers go to help us get through the vaccination, we are working through that effort. And I would echo what Brooke said.
Well, if you're telling me, and I think you are, that one of the bottlenecks is having individuals who can go to the nursing homes and give the shots, I believe it's the case that there are pharmacists all over the state of Mississippi, not necessarily CVS and Walgreens pharmacists, but pharmacists who would be willing to do that and are capable of doing that. I think there are other sources of people who can give shots. There are optometrists. There are some EMT people that are trained, that are available. There are people. I have no idea what's going on. I don't understand any of this.
Somebody's in a submarine.
This is what happens every time we try to do this. It's the most frustrating thing in the world. But there are people all over the state of Mississippi who are able to give shots, and I think would be willing to do so. I think there are plenty of pharmacists that are, for example, independent pharmacists that would be able to go down to the local nursing home and give some shots. Is that something that's feasible?
I don't think through the federal program it is. Brooke, correct me if I'm wrong. So anyone we bring on, we have to train and hire through our processes. It's not as simple as just, an extra body. We actually have to hire them and bring them on and train them. And I believe the federal program doesn't allow for just, Brooke, I don't know if you know more, but I don't think that we could just allow anybody to just come in and do it.
Well, have you gotten some new people on board and brought them in and hired them and trained them at all during the course of this?
We have, and we made and I believe, I can't speak for Walgreens, but I believe they made a similar effort, in actually a national effort in hiring once this program came on board. We had and there's actually, after we had our discussion earlier, I did check today and I sent this information to Susan as well. There is information on our website, and there continues to be information about the ability to come on board to help us with this effort. And that's been out there for a while. So we continue to and staffed up for this process and continue to do that.
Well, have you asked, for example, the state pharmacy board to round up some Mississippi pharmacists who might be willing to do this for the next little bit? I mean, that just strikes me as one source of, it's just that it seems to me what's happening is there are nursing homes. To get as many nursing home residents immunized as we can. But just based on the information that I've been given, which is not complete, but I see that Driftwood Nursing Center in Gulfport is scheduled for the 27th of January. That there's no schedule for Pinecrest and Hazelhurst. There's no schedule for Silver Cross in Brookhaven. There is a schedule of February the 9th for Liberty. There is no date for an institution in Biloxi and West Point or Bruce. There's a facility in Jackson that's scheduled for the 21st of January. Just sort of the common sense of this is it shouldn't take a month to get nursing home residents immunized. And there's something somewhere that can be done to move this along more quickly.
Yeah, Senator Bryan, to your point, we, has been already discussed, we do have the challenge here. The biggest barrier for us at Walgreens and probably others is just the manpower to physically go to all these facilities. We just initiated just a few hours ago a request to source contract nurses to support. As you've been talking about, there's a lot of folks across the state that can provide immunizations. So we are, in addition to hiring pharmacists, we are actively trying to hire pharmacists every day across the state. And now, as of today, we are also sourcing contract nurses across the state to support this. So we do have a lot of facilities scheduled out over the next few weeks, and we're looking to pull those forward. We're trying to move them up because we do understand that is an extended period of time to expect these facilities to wait for us or anybody to CVS or anybody else to show up and provide these vaccines. So that's and to your point, we're looking at every avenue possible to try and get more folks that can provide immunizations across the state to close this gap that we do have. certainly not unique to Mississippi, but we have some similar challenges in other states, and I can assure you we are looking to pull every possible lever to ensure that we get more people and across the state to move these facilities up and make this thing move a lot faster.
Well, I can see in my upper right-hand corner, Susan McCoy, who is with the Board of Pharmacy, and I know y'all deal with each other routinely. I'm just going to say off the top of my head, if there is a desire to employ more pharmacists, I'm assuming on a part-time basis, to do some of this work, Susan might be able to send out a notice that all the pharmacists would get. I know there are various organizations of pharmacists, they might be willing to participate. I'm thinking, if y'all think well of this, that for those of you at Walgreens and those of you at CVS, just to talk directly to Susan McCoy. Susan, is this something that's plausible? Or am I just, again, not understanding how the world works?
It's very plausible. And I would have loved to have been able to, I'm hearing y'all say that you've got your websites or your sites where pharmacists can go and apply, but I'm speaking as a personal pharmacist. I had no idea that was out there. So, you know, I will be glad if y'all will get me the information or give me the go ahead to get that out to our Mississippi pharmacists. We will be glad to push those links out to let anybody know that they can go and apply. But what I'm hearing you say is your hiring process is too long for that. Is that correct? And if so, why is it easier to hire nurses than it is to hire pharmacists? If the hiring process is the same, why is that hiring process different?
It's not any different. The timeline is very similar. Pharmacists, as I mentioned, we are hiring, looking to hire pharmacists every day right now, and we are leveraging the nurse piece to support that. So, and we will be very pleased if you could send something out to pharmacists across the state to help get the word out. So that would be very helpful. So.
And we're in the same boat. I think, Susan, hopefully you got what I sent you, the information I sent you earlier about our process, and there are specifics to Mississippi on that website. So you know, happy to have you facilitate that any way you can.
I would love to do that, and I will be glad to do it. We will get that out. If I don't get it out this afternoon, it'll go out first thing in the morning with those links on it, and to all the pharmacists in the state. We'll be glad to do that. I would have loved to have had those links a few weeks ago so that we wouldn't be in this position, but since I've got them today, we will work with what we've got. So we will get that out there.
I'm going to go out on a limb and say that Ms. McCoy and those of y'all with Walgreens and CVS have more knowledge about how one might find and employ a pharmacist than I do. Is I have said repeatedly, I don't know nothing about this. All I did was win an election, you know. But y'all understand how this works, and there's some way to hire pharmacists on a part-time basis, to hire pharmacists who have their own pharmacy somewhere in a small town, but nevertheless could go to some nursing homes here, yonder, and there and get some people inoculated. I just, and again, I have heard from optometrists, from emergency tech people. There's just a way to hire some folks for a short-term period of time to go give some shots. And I think the best way to get there is for y'all to talk amongst yourselves, but there ought to be able to get someone hired in immunizing fairly quickly. But it would be.
I'm sorry, I didn't mean to interrupt you.
Go ahead, you were gonna.
Yes, sir. I was just going to say, what is for Walgreens and CVS, If we found you pharmacists over the weekend and they went in and did this application that we're talking about, what is your timeline for getting them hired?
I'd have to go back. I don't know the answer to that. I'd have to go back and ask that because I don't know the process, but I can find that information out pretty quickly, but I don't know the answer to that.
And Chairman Bryan, just so you know, after our conversation yesterday afternoon, I got real busy and I've come up with a solution that I think is not ideal. We're not crazy about it because we wanted to use Mississippi pharmacists, even our independents, to help roll this out. We're not excited that we're having to bring in outside pharmacists when we think our pharmacists are perfectly capable of taking care of our own residents. But since that was kind of forced on us, I have come up with a temporary license that I think we could roll out if Walgreens and CVS will pledge to me that they're going to get these people scheduled and get them done in the next few weeks. We will issue these temporary licenses. I can get them issued as early as tomorrow if they get on there and get them done, provided that all the right documentation is there. If y'all can't get it done by then we need to use Mississippi pharmacists. I mean, it's just.
Let me say this, we need people to get immunized, and I don't think someone that's about to die of the virus or potentially is going to die of the virus cares where the person comes from, whether it's an out-of-state person or whether it's an employee of CVS or Walgreens or someone that has been hired quickly on the fly by CVS and Walgreens to go down and give shots. But there's some way this can be done, and I'm suggesting all of the above. I'm suggesting there be a way for Walgreens and CVS to get work permits for pharmacists if they think that'll get the shots given quicker, fine. And also simultaneously for them to have some sort of method of hiring Mississippi pharmacists quickly to give the immunizations. And I think we need both of those. I've got nursing home people here, and so is there information that any of the nursing home representatives need to tell us that I haven't?
Not necessarily. I will say that one of our facilities that went through a private pharmacy had their vaccines done by the end of December. But the Walgreens and CVS contracts, though, are good because they are the ones that are following and monitoring and reporting. And so I think that's probably why the majority of our facilities have gone that route versus going private. But we're just waiting. We're just scheduling. And one of ours that actually got scheduled today. So, and they had filled out the application towards the end of October, but they're scheduled for the end of January. We just want it done. We're ready for the outbreaks to go away. So keep our folks safe.
Mr. Chairman, it's Vanessa. How are you?
Well, I'm losing my mind and no one can tell any difference.
Okay.
I think I've always been this way.
I've got a couple of ideas. Just to preface, all of our members are signed up and are scheduled prior to January 31st. As far as we know, we've heard from no one that is beyond that time frame. Now, some of our assisted livings will probably be in February, unfortunately, is what we're hearing. I did send an email to you, Angela, to see what I could do to assist. I understand you had some facilities that you're waiting on some contracts. If they're our members, I'm happy to do whatever I need to do to get those to you. I do have an idea. Each one of our facilities has a consultant pharmacist. It's required by federal reg. So there's a pharmacist that visits that facility. So they have a close relationship, whether they be independents or in a corporate structure. Also, I don't want to throw Dr. Dobbs under the bus, the Department of Health, but what about the survey nurses giving some vaccinations? There are surveyors that are not able to survey right now because of COVID. I wonder if they could be enlisted as RNs to give the vaccinations. Or any nurses from the Department of Health, to tell you the truth.
Thomas Dobbs.
Yes. Hey, yes, sir. Thank you. We could look at that. Most of our nurses, though, have been deployed to help with outbreak teams and also with drive-through vaccination locations, but I can look into that. I think finding people to give shots, I think that can be done. I think it's really more of a matter of process. And we don't want to let process slow down outcomes. So, if we can go ahead and get those first shots in folks as quickly as possible, I don't think finding other people for the second and third visit is going to be nearly as challenging. We want to get that first dose in people immediately so they can get that sort of sudden impact, that 80% protection after a week. So whatever gets us there as quickly as possible, that's good. And then we can go from there.
And I would certainly pledge to Walgreens and CVS, if you will give me a list of facilities that you may be having difficulty with, if they're in my membership or not, we will do everything we can to get them taken care of. So I think I sent you an email, Angela, to that effect today.
Yeah, I just haven't had a chance to get back to it yet.
Okay.
I have been told, so keep in mind, I'm sorry, I'm going to say this all wrong. Phase A or Plan A was started on the 28th. So that meant contacting facilities during, which is normally a holiday weekend. I've been told that this week we've seen a big uptick in the amount of contracts coming back. So I think that problem has been solved. So I think we're good with that. I think it's just because it was activated on a holiday week, which it is what it is. And so we were reaching out and trying to get some of that done, and just people's schedules didn't allow for it last week, but we are seeing that flow coming in now. So hopefully things will get going. Like I said, 75% of our skilled nursing facilities out of our total have been scheduled for their first dose.
And do each of you have about 100 facilities? How many facilities does CVS have and how many does Walgreens have out of the 209?
So for skilled nursing facilities, we have 100, and then ALFs, which don't get activated until the 11th, we have 117.
So y'all are about half and half then.
Yeah, for the
Yeah,
two.
I think that's right. I'm actually looking for our, as we're talking, I'm looking for our number now, but I believe that's generally correct.
And Brooke, the same way for you, if you need to have any assistance, we are totally capable of getting those facilities contacted and online. Whatever you need, we want to help.
Appreciate that.
Is there anybody else that has anything that we've overlooked or anything else that we need to say? If not, first of all, I want to thank all of y'all for participating on this infernal Zoom thing, which I firmly believe is an instrument of the devil. But it's what we've got. So thank you, because I know all of you have other things going on. I appreciate it. Secondly, I know enough to know that all of y'all who are dealing with this are in an extreme situation and have been for months, and you all have my sympathy. And thank you, and hang in there. I would say this to CVS and Walgreens, and I hope I phrased this right. I don't always do it, but what has taken place is it is because of the agreement with the feds, CVS and Walgreens have wound up with the responsibility of getting the shots in the arms. And it sure seems to me this could be going more quickly. If there's a hiring process and somehow the bureaucracy, I'm going to go out on a limb and guess just maybe there's some bureaucracy at CVS and Walgreens, that somebody somewhere hasn't been flexible enough in order to do some part-time hires, some hires of people for short periods of time or whatever. If the regular hiring process takes too much time, I don't know how that works. But if I were worried, if I were to give advice to CVS and Walgreens, I would not want to have a bad result and a long delay, which at the end of the game, somebody's going to be looking for somebody to blame. And I think y'all are going to be who gets blamed. And that doesn't do anybody any good. So I think that there is an incentive for CVS and Walgreens, just out of self-preservation, to try to get as many shots in as many arms as quickly as possible in order to avoid some thing that may blow up down the path. And I hope I don't sound like a jerk. I'm not trying to be. I'm just saying I think that's a real world situation, and it would be well to do whatever can be done to get this done more quickly. And
Senator, I appreciate. Oh,
I think if you all talk to each other, you can certainly do better than without me being in the middle, because I'll say one more time, I don't know what I'm doing.
I was just going to say, I appreciate that. And I think, as far as Walgreens is concerned, it is our priority to do this, not just because of our reputation, but because it's going to save lives. And, we're working diligently to get through these lists and get in there and overcome challenges and hurdles, et cetera, and working with the Department of Health and the Healthcare Association. We appreciate that partnership, and this is urgently important, and we understand that, and we are working diligently. We'll continue to do so.
Well, thanks. And I understand what you're saying. It's been my experience in almost everything connected with this pandemic is that we have entities and regulators and procedures that everybody everywhere has for very good reason. And it doesn't matter if it's the private sector or the public sector or who it is, it's difficult for people sometimes to get away from the routine and act as though this is a crisis situation quickly enough. And so I'm going to say that there are probably some procedures that nursing homes and CVS and Walgreens and the board and the State Department, everybody's got. Y'all can cut through that stuff and cut to the chase a lot quicker than I can figure out how to do it. And I'm just asking all of you to do that. And maybe we can talk again early next week and see if we're making any progress. Okay?
Yeah, happy to
I've
do
already
that.
contacted, I'm sorry, Brooke. Go ahead.
So I was just going to say we're happy to do that, and just want to echo what Angela said. We want to get this done as quickly as we can because it's the right thing to do. So happy to work with whoever we can to get that done.
And I want to echo that too. The Board of Pharmacy is willing to do whatever we got to do to get our patients taken care of. That's just what pharmacists do. We take care of patients, and we want to do that. I've already, just while we've been on this call, I've already sent the links to our communications person who's drafting the email to go out hopefully today, to get that out, to get hopefully some Mississippi pharmacists in your pipe to be hired. And then we'll also, and I think everybody's already reached out to me. I think Janu from Walgreens has reached out as well, that y'all have contacted him. I'm supposed to have a call with him tomorrow to set up, to try to work through our temporary licensing thing, which we're willing to work with as well, to be able to get, we're like Chairman Bryan, we just want to get people vaccinated.
Again, thanks to everybody very much. I appreciate your taking the time.
Thank you.
Thank you.
And
Thank
I'm
you,
gonna
really appreciate it.
make sure this device is turned off so I'm not still on YouTube, and maybe all of you figure out how to do it to do this.
And Mr. Chairman, you did not say Walmart. Not once.
See, I can be trained. Thank you.
Thank you.
Thank you, sir.